Hi, I'm Dr. Smita Ramachandran. I'm a pediatric and adolescent endocrinologist. Endocrinologist is somebody who deals with diabetes, thyroid, obesity, PCOS, early puberty, late puberty, bone problems, or any other problem which is related to hormones in children and adolescents. Hi, I would like to talk about early puberty in children today. Early puberty is being increasingly noticed in both girls and boys. So when do we say it is early? Any development of secondary sexual characteristics in girls before the age of 8 years and in boys before the age of 9 years is termed as precocious puberty or early puberty and needs to be evaluated. What are the early signs that can be used to identify that the child has early puberty, or what are the early signs of puberty? The early signs of puberty in girls first can be breast development, which can be just pain in one nipple or both together or one after the other. The child may just complain of pain. Sometimes you can feel a nodule like a gant, like a child has had a fall, उसके बाद जैसे दर्द होता है, small amount of pain. It is not very excruciating. This is the first change of breast development in girls. The second is development of hair under the arms or axillary hair or pubic hair, which can also happen and are indications towards early puberty. In boys, the changes are different. In boys, the early changes can be, again, hair development under the arms, axillary hair or pubic hair. The second would be an increase in the testicular size, which will be evaluated by your endocrinologist, who will check and measure and identify if the child has had increase in his testicular size and has started puberty. Any changes before the age of 9 years in boys needs to be evaluated. So we keep hearing that children have early puberty. What happens if the child has early puberty? What are the repercussions of it? So if the changes of puberty happen very young in children, less than 6 years, most commonly, there is an underlying pathology, underlying cause, which needs to be found out and most often treated. But when it happens before 8 years of age, there are two effects. One, which is more important in girls, is the psychological effects of having periods and having to deal with it. That itself is very overwhelming because the children are small. The second is also height. Children who get puberty earlier have shortened adult height because their bones fuse early. Why? Because the time for them to grow is limited. So the transition from adolescence to adulthood happens earlier, leaving them shorter by centimeters from their actual potential. So that is the reason why you need to assess and intervene in kids who have early puberty. Are treatment options available for treating early puberty? Yes, treatment options are available and they are called GnRH analogs. Currently, there are two formulations available, leuprolide and triptorelin. These medications are FDA approved for use in early puberty. They are available as monthly or 3-monthly injections which can be given to suppress puberty and should be started in conjunction with your endocrinologist. These medications do not have any long-term serious side effects and have not known to be causing any problems in puberty resuming once you stop them, any increase in PCOS, or in fact any altered effect in fertility later on if treated.